Welcome to Appointed.
I am so pleased to be welcoming Benoit Robidoux to Appointed this episode. Benoit is a former Senior Assistant Deputy Minister at Employment and Social Development Canada and has been developing a Guaranteed Basic Income Program proposal for PEI. We are discussing the final report that he co-authored, along with other economists, government experts, academics, and politicians, and I would say activists as well, who have been in this sphere for some time. And in 2020, the government of PEI adopted the recommendations of its Special Committee on Poverty to create a basic income guarantee for PEI in collaboration with the federal government. In 2022, all parties in the legislature of PEI reaffirmed their support for a joint federal-provincial basic income program on the island. This created the impetus for the report that Mr. Robidoux and I will discuss today. Thank you and welcome to Appointed.
Thank you, Senator Pate. Maybe to start, maybe I need to tell that I'm an economist, which tell something about me. I work at Finance Canada for 30 years, including the last 5 years as coordinator of the annual budget. Then I spent the last 5 years of my public service career at Employment and Social Development Canada as Senior Associate DM, working on issues like labor market and social policy files. And an example of these social policy files was working on the poverty reduction strategy with Minister Duclos. I think this is kind of pertinent for our discussion today. So for a policy wonk like me, these are some of the best jobs you could dream of, and I had both, so kind of very pleased with that to have served in these two type of jobs. Now, how I get involved on the PI project? Well, about a year after my retirement, I received a call from Miles Karak, and he told me he was kind of already a member of a team that were looking to design a basic income proposal for PEI. This was led, he told me, by Coalition Canada Basic Income. And he said that they were looking for a former civil servant that would kind of complement the team. He thought I would be interested. We both worked together on the poverty reduction strategy when I was at the ESDC. And so I thought I was a good fit. And also, in fact, the team was quite impressive. He mentioned to me already all the economists that were involved in the projects. And again, it was a dream team to work with. So I kind of just said, I talk a bit more with Coalition Canada about the objective, all that, and I embark into that PI project bank bargain with a lot of enthusiasm and interest. I really encourage people, the report is on the website. People should go and see, and the team, which is 20 plus people, is there, and you will see it's a quite impressive team.
It is an impressive team, and listeners will be able to go to the links to this podcast and be able to access the report. The report talks about, and I quote, implementing our proposed GBI benefit and PEI for those aged 18 to 64 would lead to the eradication of deep poverty, as well as substantial reduction in overall poverty rate from almost 10% to nearly 2%. And I'm curious as to what you were looking at there. And I know I've had some discussions with other members of the committee, but how did you come up with this? How do you see this happening? And any other material or explanation you want to provide to expand on this would be very helpful.
So we achieved such considerable reduction in poverty by setting the maximum guaranteed basic income at 85% of the poverty line. This is about 19 in PI for 2022, which was a year we used. Then for the benchmark, $19,000 for an adult, single adults, and $27,000 for a family of 2 adults. So that was the benchmark for the benefit. So it's pretty kind of a bit similar to what Ontario did in their pilot, a bit more generous. and similar to what the PBU has looked at, for example, but a bit they're more generous too, but similar. The benefit is income tested, so this is not a universal. It's universal access, but it's not provided to everybody. Whatever is their income, so it's income tested. And for every dollar of income, the benefit is reduced by 50 cents. So in the economist lingo, it's a reduction rate of 50%. It's delivered we propose to have it delivered as a mixed administration between PEI and the federal government, and using the tax system to make it simple and easy for people to access. Maybe not as easy as we would like, because not everybody people feel their tax, but pretty easier than having to fill a form and apply. And finally, this new benefit would interact with other income tested benefit and tax credit, but would not replace any of the program that exists now. So we're adding this program to the foundation of program that already exists in PEI. For example, social assistance, which is often people will say would be replaced by a basic income, remain in place. It would interact, and so a lot of people on social assistance probably would be moving to this new benefit, but many people would stay on social assistance. For example, when something happens during the year, they get hit by a shock, they would move into social assistance, and only over time they would get into that benefit, because again, that benefit would be managed the same way the federal government manage, for example, the Canada Child Benefit or the Guaranteed Income Supplement and OS. People are rolling once a year and they get quarterly benefit, but they get rolling into the benefit once a year in the middle of the year in July. So a bit more about, so it looked great, I think so, the reduction in poverty, but then people said, well, let's start with the deep poverty. We're all kind of very happy with that when we simulate, there's nobody, and deep poverty for your listener is basically 75%, the income that is 75% of the poverty line. So if you are below that line, you are, based on the official framework built by Minister Duclos and now offshore in Canada, you are in deep poverty when you are below that. So nobody will be below that line of 75% of the poverty line. So that's quite an achievement with that kind of proposal. And on the 2% of islanders that 18 to 64 that remain in poverty, what is important is that when you dig into the data, those are the people, in fact, that see the most dramatic improvement in their well-being, probably. Because on average, you move from having income of 40% of the poverty line to 90% of the poverty line. So they basically in very deep poverty before the program, and then they move just below walking distance of the poverty line after the proposal is there. So one way to see the proposal, instead of the number you quote, is just to say that we essentially eradicate poverty for 1864 islanders. And I would say, and their children, because we don't provide benefit in this program for children per se, but, for families that have children and that are in poverty, this means that for their children also they move out of poverty, and this is pretty important in the result.
That's fantastic. And, I'm glad you point out the ways that this impacts also children, because often we hear people interested in supporting eradicating child poverty almost as though they arrive on the planet without parents, and children are in poverty because their parents are in poverty. I think there are a number of other innovative approaches proposed in the report. Are there more that you would like to highlight?
What I think is new and innovative in the report and the way we did it. So we, as you mentioned before, we began with the report of the Social Committee on Poverty in PEI. They had some simulation, but also principles to follow. We basically more or less adopted their principles, but we added principle, for the group. And this was, having to work with the politicians on the group, former MPs and current sitting MLAs in PEI, was the idea that they really the group wanted to minimize the cost of the program, so to be as much as possible targeted to the poor. one of the big issue with these income tests, although they are income tests, often a lot of value of the benefit is provided to people that are not in fact poor before you start the program. Also the idea to minimize the impact on labor market. So those were kind of two concerns that was there. And so in fact, when we started that and read a bit on the literature, we found that often a critique or a concern of basic income proposal are, they are too expensive, difficult to finance because very expensive. You need to really kind of shake the tax system to get something that could be implemented. And, some people are still kind of concerned about the disincentive to work that people may face that receive the benefits. So I think one of the big innovation in the paper is basically we got the first result we got was in fact similar, pretty expensive, not very targeted to poor. And so we moved to the innovation there was to move to a broader family structure to make the payment. So we basically went to a family where, for example, if you live with your children and you have a children that is over 18 but live with you, the typical, like most benefits like that are provided in the country or that's used by other researchers, basically these children are assumed to be a separate family. So they receive benefit for themselves, although they live with their parents. What we did is to include those children over 18 living with their parents in the same family unit than their parents. So basically, in the technical term, we don't use a nuclear family that everybody use in research, or in fact for all the benefits basically that, as far as I know, that the federal is delivering, use a nuclear family. We use the census family, which is a very technical term, but just mean that those people are lumped together, not separately. With that kind of broader family structure, we're targeting quite better the poor than otherwise, and it reduced the cost of the program and the impact on labor market, both of them substantially. Give you an idea, the gross cost of the program, which is the cost that is reported in the report, is reduced by 40%. What I need to mention is the impact on poverty is exactly the same. So you achieve the same level. So you are way more effective in targeting the poor with that. I mean that we were able to reduce the cost from 300 million to 188 million. The other innovative thing we did in the report is that this is a gross cost and it's not the net cost. And the net cost would suppose you implement that today in PEI, how much it would really cost at the end of the day. And as I mentioned before, this program would change income of people and would affect other income tested benefits. So you would, for example, receive a bit less Canada Child benefit, but in total, you would receive a lot more. So it's just a small offset there because you get a bit more income, so you receive a bit less CCB. And it's true for all these other income tested benefit at the provincial level. It would affect also it would interact with another big one that was a bit of a surprise to everybody on the group, but would be a big overlap is for the youth, the student assistance the country has would really kind of interact with that and create a savings one side or the other. So the net cost would come to is something like 100 million. So you're getting from 200 to basically 100. So it's kind of way more affordable. This is basically 1% of PEI GDP or 4% of their revenue or expenditure. So we are basically getting into this world of feasible, affordable, that reasonable people will say, let's talk about that because it's not so big. So it means that you're not creating the most expensive program, for example, for PEI, but it will be in the top 5 list of programs, but not so expensive that you would say, well, do we want to create the biggest program we never had? For example, the BC Basic Income panel, often, if you read, I was reading yesterday their book, they said, well, when they look at universal basic income, they come to double the expenditure of the province. Well, do you want to double the expenditure for a program like that? You may really want madly that program, but it's pretty expensive. So people have quite kind of cool feat about doubling the size of the expenditure. In terms of labor supply impact, the fact that we are more targeted and we touch less people mean we end up also getting less impact on labor market in the short term. The impact there is reduced by 30%. 1/3 of the impact is going away. And finally, maybe the last thing in the proposal that I need to mention is that often proposals talk about the basic income, we do simulation, which provides kind of impact on poverty and the cost, but would just stop there. And it would not explain how this benefit would interact and be administered in the country or in a province. Just leave it at that. I think the paper, another kind of value of the paper is to provide more discussion about how the benefit would interact with income tested benefit and also other non-income tested benefits like EI or CPP, large benefit to the country, how they interact. And again, it's pretty simple and it doesn't create much issues. And the idea that it would be administered through the tax system, in part by the federal government, but also with PEI. So all that is kind of described there. The benefit would be updated every year, things like that. So people could see how this would work, and I think it does make way clearer what a GBI like that could achieve and what it couldn't achieve. So it's also forced us not to kind of claim things that would never happen, because this is not the type of benefit you would have the right parameters to get after some things that sometimes are mentioned in that world.
Great. And I want to come back to some of the longer term savings as well as any comments you have on moves that are being made within the tax system to do more automatic tax filing that could make the tax system even more agile than just once or twice a year being able to adjust. But I'm particularly interested, as you know, I introduced Bill S-233, and I'm curious as to what significance, if any, you see of including this type of initiative would have, and what role the bill could play, what role the demonstration initiative might play in helping encourage that type of federal initiative.
Well, I think what we propose here is a framework for a GBI that could be implemented without in federal partnership. This could be applied anywhere, right? So everybody could go and run with that model. I think if any province would be interested to run a GBI for 1864, I think they should look at our proposal, and I think they would be probably interested. Now, I think what we're proposing is a 5 to 7 year demonstration project in PEI, because we believe that in between a pilot, this is kind of not a pilot, not a permanent program, but it's basically a permanent program for 5 to 7 years in PEI, and you could do it elsewhere. But the advantage of PEI is really it's small, and if you do it as a partnership with the federal, it really split the cost, and it would mean an opportunity to provide a lot of evidence for other provinces and for the country to say, okay, what happened when we would do that at scale with all the interaction? And the only thing that we would have is it's not permanent. But could be kind of, for economists, one of the issues is always this thing is never permanent, so people will not behave like it would be permanent. But if it's 5 to 7 years, like a 7 years program for many people could be viewed as a quasi-permanent for them. And so we think it would be, testing a model that could be useful, really useful for other provinces and for a national government that would want to put that at scale. So it would provide a level of information I don't think we have. Like, we have a lot of information on pilot projects. Again, the iPilot, some were well designed, like in the 70s, that pretty well designed. Others, like Ontario, was not very well designed. So information there, it's not worth a lot to decide how to move forward. So I think this would provide a lot of evidence for the other provinces and the country in general to move forward.
As you probably know, my advocacy around this area dates back more than 3 decades. I worked a lot with folks who are failed by every other system. And so a big part of why I came to the Senate was to look at how do we build robust social health and economic supports and systems. And Susan Hartley, a member of the PEI Working Group for Livable Income, indicated in an op-ed that the amount of unemployment, unhoused populations, and the number of youth living in poverty, living below the poverty line, continues to grow. Similarly, the unmet needs of the healthcare system have also increased. And she indicates that the best support for PEI's healthcare system is to improve and promote the existence of healthy citizens, and points to the guaranteed livable basic income as one of these options. How do you see it could alleviate these issues and contribute to healthier citizens, as well as what impact do you think this initiative might have on the health and well-being of islanders more generally?
Well, as I said to you, I work on the poverty eradication strategy with Minister Duclos and the team there. And, it's pretty clear by the time you get on the ground, you see that for people like, I don't know, you or me, in my case for sure, poverty it's a bit of an abstract. It's a statistics, particularly for an economist. But when you get on the ground, you see that it's both deep and far-reaching in terms of what's made in your life. And for people living in deep poverty, for example, their life is just miserable, and it's very difficult to even get at the end, to go through a day. And so clearly a program like that would radically improve and transform their life for people living in poverty. And the literature is there, and it's pretty obvious, I think so, that you would expect the well-being of these people to improve, and through better income for food security, for example, it's pretty obvious. If you get the money to buy the food, you get better food, and so you could arrange yourself quite better for that over time. As I mentioned, that for the children of those families, for the adults of having either no job or a bad job, education and training could be quite improved for them. To access to education and training could be quite improved. Housing is another obvious one to me. Having a more adequate housing when you get the money is and the cash is quite obvious. I think, for example, the Ontario result after a year, the community involvement and a better kind of family life could also be quite obvious there. It seemed to come very quickly, which is all positive. And the big one, clearly, over time should be health. So healthier people. And again, I guess one of the issue we have is that there is quite evidence in Canada and other countries that for the low income, the amount of, the relationship between income and health is well established everywhere. There's a correlation between the two. And when you have lower income, you tend to be less healthy, and you need to use the health system more. And like for Canada, I look again yesterday at the result for recent years, and the system spend a lot more money for people in the first and second quintile of income. So the bottom 40% of income of people, you spend more money there than otherwise. The extra spending, the amount you spend per capita when you get into the middle income, the third quintile and after, it's pretty stable, but it's quite higher at the bottom part. If you say, what happened if these people no longer have so low income and would come toward the middle income, maybe not at the middle income, but toward, and you look at this extra spending, and it's a lot of money. It's 26 billion for Canada and 240 million for PEI. So I'm not saying that this would be savings over time, because there's this difficult relationship we deal with among economists, which is clearly when you are not healthy, you don't work a lot and you don't have a lot of income because of social program and not so generous. So you get low income, and so giving them better income with these people are likely to stay ill if they are ill, and so there will not be a lot of change here. But there's the other way around too, which is you get low income, bad food, all that, stress, and then you end up to be ill because you are poor. and savings, fixing the money issue would also over time fix the health issue. So I think there's no consensus about how big this would be, but reasonable people agree it will be probably quite important. What is the exact savings and all that? This is not very well defined, but the potential is large. And if I would be a Minister of Health, I would think a lot about trying to fix a bit that problem to help the system to have less pressure on their spending. And the other one I wanted to mention absolutely is coming back to the children. So where we have evidence is what happened when you have family with children that live in poverty, and then you gave them cash transfer on a sustained basis. And then what happened to these children after? Are they going more to school than otherwise? Are they kind of going further in their studies? Do they get higher income and all that? And there's a lot of studies, mainly in the US, which is too bad, but mainly in the US, that shows that there's a strong link there, and that the return on that investment is pretty large for the children and for the society at large. And so I think that's another benefit that people should think about. It take a generation basically to get there, but for those people, those children, it's a major change in their trajectory, and for the society, it's major too. Take the time. You need to be patient, but it's pretty important.
In some of the discussions I've had, particularly with some Scandinavian countries, they are seeing some particular benefits and projecting cost savings for particularly those with disabilities, the elderly, Indigenous peoples.
In terms of the groups that would be impacted, the one, again, to me that surprised people, sometimes people make a disconnect when they see these things between children and their parents. But again, the poverty rate for children is reduced from 9% to 3% in the simulation. So that's, again, an impact on children that is pretty important. Person with disabilities, it's harder to say. The modeling we have first start with some limitations. So we could only identify, I would say, the core of person with disabilities, which is those who receive either CPP disability benefit or disability tax credit. So with that, we could indirectly identify, which I believe should be the core of person with disability. And for them, the poverty to start is not super high in the data. It is what it is, but it's basically eradicated. So there's no longer poverty for person with disability. Now, again, we have some caution about that. We don't have the full sample of person with disability clearly here. And also the framework, the MBM framework of poverty in Canada, assume that for a person with disability, they need the same type of income to be not living in poverty. But clearly, for people who have acute disability, they need to incur other expenditures than other people. And so the framework is not well adapted to I believe, to person with disability. And so we need to be cautious about the result there. But clearly, the proposal will indicate that it would support them and help them to a level. And it's just people, clearly, they are one of the poorest group in the country. If you look at result, what is published, which is, and it's just on outside reserve, it's one of the highest poverty with immigrants we have, recent immigrants, and we don't have data on reserve, but I think it would just worse. And so they are the type of people that would probably benefit the most from that type of program. And but we didn't spend much time on that in the report, but we sent the report. If PEI, for example, would like to implement this thing, they should consult with Indigenous people and their communities to kind of make sure they could do the most of the program with them.
And in fact, I've had discussions with both chiefs of the First Nations on PEI, and there's strong support for this because of, I think, many of the issues you've raised. And as well, one of the things that struck me when I met with folks on PEI about the need for a guaranteed livable income, including the Premier, was that they talked about the fact that the savings and the costing hasn't really included as much the fact that people who get money in the community spend that money in the community as well. And so the benefit on the economy writ large is also another issue that certainly many folks have talked about when I've been speaking with them. You've provided a very fulsome description of the initiative. I'm very grateful to you for being on this podcast to help share that information for our listeners. And anything else that you'd like to say before we close off?
Well, maybe in closing, I would start with a personal note. I would admit something. I would admit that when I began working on that proposal, I thought it would be difficult, if not impossible, to design a proposal that would be affordable, implementable, and practical. I was aware of the literature. When I was working in the government, I kind of look at these proposals, we look at them, and it was always this wall about it would be great, but it's kind of difficult. And we had a few innovations, as we mentioned, and I changed my mind. So I'm pretty happy to mention that. And I hope other people that would read the report that would like to reduce poverty substantially, but thought this is not feasible or practical, obviously, like me, would change their mind. So I encourage all these people to read the report. And there's a lot of other testimony, other things on the site. There's also supplemental notes on, for example, the net cost I mentioned, on the youth. There's a few impact with the youth that are worth to talk about, and they're mentioned there. And also on the evaluation that we would propose, evaluation plan we would propose to go with, and a bit more details than in the report about the evaluation plan for that proposal, if it goes on in PI. The other thing I want to mention is often, I don't know, one way to summarize what we did is often these proposals we see for basic income are a revolution. It's to create a revolution. For people, at least it feels like a revolution of the social safety net of the country. And what we propose, I hope people reading the report, this will come clear to them. It's just an evolution of the system we have. And it has the potential to create that missing piece in the social safety net that would make it complete and fulsome for the country and for PI, and hopefully for the country in the future. The other thing we're quite keen is this idea again that after reading that, some people may say, well, we're not fully convinced. We still have some concern. And what we said to these people is, we understand, it's okay. It's okay to have concern, and we don't really have the truth. And things may happen that we have not expected, positive and negative side. But again, our point is always, let's do a demonstration in PI for like 5 to 7 years and see what happens. And then we'll see what it is. So testing the model in PI for us should be, even for people with some concern, something they should support or think about supporting. So we hope the federal government would sit with PI and hopefully get that going. And we also hope that the model we have presented would be useful for future work and conversation in the country about reducing poverty. So that's about it. And I really thank you, Senator, for having me on your show.
Thank you so much for sharing your knowledge, your expertise, your experience on the PEI project, as well as your experience more broadly. And I'll try not to pull you out of retirement again, but thank you very much for all the work you've done in your lifetime, but also on this initiative.